Just gonna use the computer. So Techstars is a global ecosystem that empowers entrepreneurs to bring new technologies to market wherever they choose to do business. Here in Minnesota, we're doing a number of things. As you can see, there's Startup Weekend, which some of you might be familiar with, or Startup Digest, because we have it here in Rochester. It's because he co-organized, that's why. We also have Startup Weekends all over Minnesota, Iowa. We've done them in over 2,000 locations across the globe, so I'm happy to say that we have that here. We have Startup Week. If any of you have been up to the Twin Cities and seen that, we've been running those for about 7 years now. Startup Next, we are launching that with Land O'Lakes. That was just recently announced, and that's going to be around food and agriculture. And then we have a retail accelerator that actually just launched last Monday in the Twin Cities, and that's with Target. And then you have my program, which is Techstars Plus. So Techstars Plus is a collaboration between Techstars and Mayo Clinic. It's a business development program with the aim of leveraging innovative technology to improve patient care. Now, it's not just about getting new technologies into Mayo and improving patient care, and there has to be some sort of benefit to all of us. So we try to provide connections, not just for our founders and for the physicians and clinicians here, but for the community as well. And we're doing that through different types of events. Last week, a lot of you might have been to the DMC Mayo Clinic co-hosted event that we had over at UMR, where we had Troy Hennicoff talk about Chicago and how they were able to create a tech ecosystem there. We've also brought in Techstars co-founder David Brown and numerous other managing directors, and we'll actually be doing the same thing next month. And we even have some wonderful kids who have been interns in our program. This past program that we ran last week, we had 11 interns, and they're all in high school, guys. And what's the impact here? So we partner with a lot of programs here in town, DMC, Journey to Growth. We were integral in TEDx Dumber River. I mentor at Technovation, BBPA, and we're hoping that as this continued partnership progresses, that we're able to find more opportunities to connect with our community and grow the entrepreneurial ecosystem here. These are some pictures of the Startup Weekend. I want to tell you a little bit more about this because I'd like to have another one of these maybe next year here in Rochester, focused on not just youth, but for the entire community as well. In this program, in a 54-hour time frame, you go from an idea on a Friday night to a Shark Tank style pitch on the Sunday, which is basically like what you saw all this afternoon. We also work with Girl Scouts. We raised over $2,000 for them with that rappel at the U.S. Bank building, if you remember that. And if you have any questions about entrepreneurship, you might want to read a couple of these books. I would start up with Startup Communities. It's a great book by Brad Fell that talks about Boulder and how they got started, and it's very comparable to our world here in Rochester. But if you have any questions or just want to chat, get some feedback about what you're doing with your startup, feel free to contact me. It's my card.
Thanks, Michelle. All right, Xavier, you ready? Do we time you and everything too?
Good afternoon. My name is Xavi Frigola, and I'm a former researcher like many of you, but for the last 3 years I've been helping the local startups in the Mayo Clinic Business Accelerator. The Mayo Clinic Business Accelerator is located in the second floor of the Minnesota Bay Business Center, and our goal is to help the local community by helping the local startups. To that end, the accelerator acts as a business incubator 45 weeks of the year. We have space, we organize networking events, we have links to local service providers, and we have connections to funding sources. 4 to 5 weeks out of the year, we act as a business accelerator, and we host outside companies to Rochester. They come and partner to Mayo Clinic, and that's in combination with Techstars and Mayo Clinic Ventures. There are currently 22 companies in the accelerator, and 3 of them have graduated, expanded operations, and remained in our community. Our service to the community is reflected in the number of jobs created by those companies, and a testament to their health is the number of dollars that they've raised, that they use to hire more people and grow. We organize 1 to 2 entrepreneurial events. Those are open to all the community to attend, all culminated with an entrepreneurial gala at the end of November on the last day of Global Entrepreneurship Week. And we are open to the community, as you can see in the slide. We host local educational groups and cohorts. There are many planning events that have, and the space is being used by many planning events, like Rochelle was mentioning, our first TEDx Amber River and our first own startup weekend for high school kids were organized on the accelerator by the community. If you want to participate, I would encourage you to start by joining the mailing list and attend one of our events. And if you want to talk, my information is on the slide. Thank you.
Excellent. Thank you very much. So I'm Jordan Miller. I'm an associate professor in the Department of Surgery. And so how many people in here have ever had an idea for a device or a technology that they really thought would be, important and good, right? In the medical practice or elsewhere? How many people actually knew exactly what to do with it or where to go with it or how to get funding for it the moment that you had that idea? Right, and especially if you're in Mayo, usually the best thing to do is just pound your head on the counter sometimes, and you just hope that the idea just goes away, because the process is pretty frustrating, right? Anybody who's ever done that really knows that's the truth, right? So for us, in the Department of Surgery, what we did is we established an infrastructure it's called the Innovation Accelerator. And so what is the Innovation Accelerator? So we're actually a rapidly expanding infrastructure that focuses on 2 major things. One is rapid device prototyping. And the second is the facilitation of partner formation, both inside and outside the institution, for commercialization of ideas that individuals have within Mayo Clinic. And so with regards to rapid device prototyping, we really have one fundamental goal. And that is to develop a minimum viable product, to go from idea to tangible product in 12 weeks, right? And so what most people come in with is they say, hey, this is what I really want, right? This is my minimum viable product. And we say, that's funny, that's great. That's like $250K at the very minimum just to even get part of the way there. And a lot of times you go somewhere else and they'll say, well, this is what we'll give you for a pretty sizable chunk of money, right? And you say, well, I can't pitch that to anybody, right? So what we do is we sort of end up somewhere in the middle where we get you something that'll get you from point A to point B, and you can actually take back. It's tangible, it's testable, it's usable, right? But then you can use that to pitch other people to really move that device forward and get it out of the institution and really get it into the practice. So you'd say, well, can you actually do that inside a 12-week period? Because anybody's ever tried to generate a device, would say that's pretty challenging if it's a technically oriented device. And so we actually generated 7 devices in 2015 with 7 different investigators, and currently we have 9 additional projects underway in 2016. And so we don't have time to talk to you about those today, but if you want to discuss any of those, I can connect you with these people, or we can talk about it offline. And so I think for us, our selection criteria, it's fundamentally based around the importance of the problem, right? So it's patient impact and not necessarily population size. And so anybody who says, well, that population is really too small, I would say, well, in Mayo, the tip of the pyramid is also the smallest part. So if you really want to have an impact, that's one significant or most significant criteria for project selection. All of the projects are peer-reviewed, so for surgical products, they're reviewed by surgeons. For clinical products, they're reviewed by clinicians, so on and so forth. The feasibility, if we can't get it done in 12 weeks, we're going to shoot you pretty straight on that one. And then finally, it's commercial potential, right? So that's really our final discerning point, not really out of the gate. And so you can say, well, that sounds pretty good to be true, too good to be true, and nobody can really be a one-stop shop for everything, right? We've done catheter-based technologies, we've done tools, devices, so on and so forth. I'm not going to lie to you, we're really not. What we do is we take your idea, we shop it around institutional resources. We've got the classic alphabet soup here of OTP and MCBA and PBME and so on and so forth. But we also, importantly, we take it outside of the institution as well to trusted contract research organizations that can do things a lot faster than we can internally a lot of times due to the specialization of the companies. And so with that, that really allows us to operate in a unique space and move things along very quickly to minimum viable prototype. Now, in terms of partnership facilitation, we have a sort of an inside-in approach where we connect people working on similar technologies together to get functional innovation groups. And then we also work inside out and outside in, really. So, we connect investigators to companies and startups. We've worked with Rochelle to try and connect Techstars people to internal investigators who can provide some insights. And we'd be happy to work with Twin Cities-based companies as well to try and build the community here. And of course, if Kelly or anybody else from MCBA is watching, they would say, well, we appreciate knowing that we do try to work with know-how agreements when appropriate. So collectively, you say, well, why should you contact the Innovation Accelerator with your idea? Or if you're a small company, why should you get a hold of either myself or Jamie? Because we would argue that no patient at Mayo Clinic should actually have to wait for a better solution. And so with that, we'd be happy to connect with anybody afterwards. Thank you.
Jordan.
Yeah. So, as an insider, how is the IP protected when you talk to the outside contractors?
So we have all of our outside contractors sign a non-disclosure agreement. We do everything we can up front to ensure that everything is protected, at least from to the extent we can with intellectual property agreement. Whether it's we don't most of our people actually don't have patents, because we go to the point where if you have an idea, I hate to say it, but a lot of times people. How many people go on Mayo Clinic Ventures and they say, well, you don't really have any IP around that. And you say, well, this isn't having a problem though, right? So we do work with what we do is trusted organizations outside of the institution that have a long-standing relationships with Mayo to ensure that that the IP is completely protected. Yeah.
Awesome.
Yeah. Thank you.